Hello everyone and welcome back to my playlist of pathology. We are doing this from medium Robbins और chronic skin dermatoses अब हम cover कर रहे हैं. Already talked about psoriasis. Today we are going to talk about lichen planus. Now lichen planus is pruritic, purple and polygonal and planar and plaques. So everything starts with P and that becomes easy if you tie this P to the planus P. So that's lots of P's in there. So they are usually purplish appearing lesions. They are pruritic, इनमें खारिश होती है. They are polygonal many of the times, not all the times, but usually they are polygonal, so they're not circle. So you can have like a ring, like a pyramidine ring, something like this. And they are plain and they are plaquey. They are not simply a rash, they are plaque-like. So if you feel them, you start having an idea okay, what I'm talking about. So a lot of P's in there for lichen planus, okay? And so यहाँ लिखा भी है कि are the tongue twisting P's, you know, if you start calling them, this is a good tongue twister. Tongue twister पता है ना, कच्चा पापड़ पक्का पापड़ इसी तरह pruritic कहीं ना कहीं फंस जाएंगे P में, okay? Now the lesion may result from a CD8 positive T cells. Now you see a lot of skin conditions are because of inflammatory stuff. So here it is because of cytotoxic T cells, right? And some antigen in the basal layer is the culprit, and the dermoepidermal junction, they are produced by unknown mechanisms, perhaps a consequence of viral infection or any drug exposure. So that antigen again is not very well characterized, but what we know is that it is somewhere in the epidermodermal region. So if you look at the diagram, that is the epidermis, this is the dermis, so the junction is affected. There is an antigen in the basal layer perhaps, which is initiating the CD8 positive response, okay? So that's the pathogenesis, very simple. It's not very common, it's an uncommon disorder that usually present in the middle-aged adults. The cutaneous lesions are multiple, they're usually symmetrically distributed, दोनों sides पे मिलेंगे, extremities के usually. They're also found in glans penis and elbows and vulva, so genital involvement is there. Approximately 70% of the cases also involve oral mucosa. Now that's an important finding because that usually is not the case in, for example, psoriasis. So if you, in the examination, if you have a clinical vignette talking about a patient who have these lesions, or they may give you an image, then you should also look for if they have indicated you something with the oral mucosa. If yes, think about lichen planus, okay? The cutaneous lesions of lichen planus usually resolve spontaneously without any treatment in a couple of years, but the oral region may persist and be of sufficient severity to interfere with food intake. You समझ रहे हैं इतना disturbing हो सकते हैं, so the person may want to have a clinical intervention there, right? Now cutaneous lesions of lichen planus consist of pruritic, violaceous, flat-topped papule. अभी हमने ये बात की भी. The papules are highlighted by white dots, sometimes, not always, and these are called Wickham stria. ये आपको पता होना चाहिए. And this is also an interface dermatitis. Now when we say interface dermatitis, it basically means that epidermis or dermis के junction पर you will see all these inflammatory cells. So this is one of the dermatitis which involves the dermal epidermal junction. There are many others. अभी हम जब bullous disorders पढ़ेंगे तो वहाँ पे भी हम will talk about a few disorders which affect the dermal epidermal junction. This is one of them, okay? And there is a dense continuous infiltrate of lymphocyte along the dermoepidermal junction. That's an important point. The lymphocytes are intimately associated with the basal keratinocyte, very close, because we believe that ये जो inflammatory insult है वो start ही होती है from an antigen which is in the basal keratinocytes, in the basal layer. You remember epidermis की layer में जो पहली layer है, that is the basal layer, okay? Right, perhaps as a response to the damage, the basal cells take on the appearance of the more mature cells of the stratum spinosum, and this process is known as squamation. So that's kind of a metaplasia. A cell type is converted into another cell type, and you know the spinosum layer was up there above the basal layer. So the basal layer matured and looked like a spinous layer, and this is then known as sawtoothing because there is then a zigzag patterning of cells appearing like a spinosal layer, but they were initially at the location of the basal layer. So this is called sawtoothing. So if you see sawtoothing, that's sometimes a pinpoint diagnosis. If you see this word, think about lichen planus, okay? If you hear this word, Auspert sign, think about psoriasis, but that can happen in other conditions as well, okay? And then there is another condition which also have word lichen in its name, lichen simplex chronicus. It manifests as roughening of the skin which takes on an appearance of reminiscent of lichen on a tree, and that's why it's called lichen simplex. It is response to local repetitive trauma, usually from rubbing or scratching. बार बार एक ही जगह पे, जैसे वो नान बनाने वाले होते हैं ना, उनके घुटनों पर ये देखी जा सकती है. So they have like continuous irritation in one particular point. That's usually because job related. Nodular forms exist that are referred to as prurigo nodularis, very rare condition. The pathogenesis of lichen simplex is not understood, good for us because we then don't have to study it. And clinically the lesions are raised, erythematous, scaly, and can be mistaken for keratinocyte neoplasm. So that's an important point for them. It is always there in the workup of skin malignancy, right? That's an important point. Lichen simplex chronicus can be superimposed on and mask another dermatosis. It is therefore important to rule out the underlying cause. So basically it's a very rare disorder. इसकी pathogenesis clear नहीं है, clinically erythematous rash होता है, and that's all about it. So इतना ज़्यादा exam में इसके बारे में basically पूछते नहीं है, but Lichen Planus is an important one. Okay, and a few names that I told you, like psoriasis, maybe talked about Osbert sign. In Lichen Planus we talked about sawtoothing and the mechanism, how it works, where it works. Basically it works at the dermo-epidermal junction. Okay, so that's all about Lichen Planus, and next video we will start focusing on those dermatoses which is because of infectious etiology. So stay tuned and we'll restart the infectious dermatosis in the next video. Take care of yourself.